Cushing syndrome. This condition results from high levels of corticosteroid in the blood and is associated with various changes in the body, including development of obesity, hypertension, diabetes, and osteoporosis. A prolonged use or abuse, especially by women, for cosmetic reasons of oral and topical corticosteroids such as prednisolone, dexamethasone, hydrocortisone, or cortisone, or preparations containing any of these drugs is also a cause. The main causes are pituitary tumor, adrenal tumor, prolonged and excessive intake for asthma, nephrotic syndrome, and among others, or abuse of corticosteroids. The symptoms are weight gain, excess body hair and acne, pimples, easy bruising of skin, stretch marks, reddish or purplish, menstrual irregularity and subfertility, weakness of the thigh muscles, lightening of the skin. The signs that are usually elicited are rounded or moon face, prominent supraclavicular fat pads, truncal obesity, excess facial and body hair, acne, striae, as reddish or purplish stretch marks, thin skin, easy bruising and bleeding into the skin after venipuncture, hypertension, inability to rise from the squatting position. Investigations are plasma cortisol, commonly elevated in pituitary and adrenal tumors but low in corticosteroid use or abuse. Blood electrolytes, which may show low potassium, so blood glucose commonly elevated. Abdominal ultrasound scan may show an adrenal tumor. CT scan may show evidence of a pituitary or adrenal tumor. The main treatment objectives are to normalize plasma level of corticosteroid, to correct electrolyte imbalance, to correct plasma glucose, to correct blood pressure, to prevent complications of excess plasma cortisol. Non-pharmacological treatment: the pituitary or adrenal surgery where tumors in the respective glands have been diagnosed. Pharmacological treatment: so the treatment is dependent on the cause and requires specialized investigations to manage hypertension and diabetes along the standard treatment lines, and also refer patients for definitive treatment. Do not withdraw corticosteroids suddenly in patients with Cushing syndrome due to corticosteroid abuse or prolonged use. Instead, the dose must be tapered off slowly over several weeks and months to prevent acute adrenal insufficiency. So, referral criteria: refer all suspected cases to an endocrinologist or specialist physician in a regional teaching hospital for the appropriate investigations and management.